Hi, I'm Dr. Ilana Rosenberg. I'm a clinical psychologist in private practice in Scarsdale, and I'm here with Dr. Suparna Basu, a psychiatrist in Westchester, and we're here to talk about her practice.
Hi there, I'm Dr. Basu. I'm an adult psychiatrist. I also see adolescents. I have a private practice of my own. Mostly it's telemedicine at this point. The hope is that at some point, once the pandemic is over, I'll be able to do a mix of both.
So, Dr. Basu, tell me what kind of patients you like to work with.
I mostly work with adults. I see a whole spectrum of patients. I'm not very particular or choosy about a particular disorder. I'm pretty comfortable with treating most psychiatric disorders. But I can tell you one thing that most of my practice has patients with anxiety, depression, mood disorders, a few with schizophrenia or bipolar type 1, some OCD, some PTSD, some peri and postpartum depression.
Oh, wow. So you really run the gamut, lots of different types of people and disorders that you treat.
I do. I love what I do. I feel very, very passionately about my field, and I enjoy treating every single patient. For me, every single patient is very unique.
Absolutely. So tell me about your values and goals as a psychiatrist.
Sure. So I think the best way I can describe myself is that I'm a very humanistic person. I usually have a very collaborative approach. I tend to be very transparent with my recommendations. There's nothing hidden. I am extremely patient. I encourage patients to ask me questions. I ask a lot of questions until I am satisfied that I have reached the correct diagnosis. If I'm not sure, I'm very upfront about that. I'm able to tell my patients that I'm not sure, and it'll take a couple of sessions before we confirm what diagnosis they have.
Hmm. That sounds great.
Thank you.
Yeah. So tell me more about why you do what you do. Why do you do psychiatry?
Sure. So I think why I do psychiatry has a lot to do with who I am. I enjoy helping people. I think that's what my purpose in life is. I feel extremely privileged that my patients give me that opportunity to connect with them on such an intimate basis. Not everybody gets that, so I feel very fulfilled at the end of the day doing what I do, and I have no regrets at all.
That's great. And what techniques do you use with your patients?
Sure. So I mostly do medication management. I almost always include therapy. I value therapy a lot. I recommend it to almost all my patients. I do feel that meds in conjunction with therapy work the best. I usually will go over the pros and cons of medications, the alternatives available, the risks, the benefits, the duration, the prognosis, everything in every single session.
Hmm. Okay, good. And what's your style with working with patients?
I think that the what I want to say, I think my style is that I want to make my patients feel like they're always going to be heard. I'm very patient. I never make my patients feel rushed. I feel like I may be the expert on medications, but they're the expert on their own body. They know what works for them, what are their symptoms, they have tried, how what they have experienced. I feel like my approaches would be best described as something as teamwork. I usually always encourage them to include a family member, a therapist, a primary care physician, whoever they're comfortable with in their treatment team. I love working with therapists, especially as a team.
Sounds great. So, and how do you feel like telehealth is working for you with your patients?
Yes. Um, so I feel that telemedicine is working great for both me as a physician and for my patients. I feel like it has cut down on their travel time. They don't have to take time off from work. They don't have to arrange for childcare. As a physician, I feel like I can give them late appointments. I can give them early appointments because I am working from my home office. I really not felt that I haven't been able to connect with a patient because of technology. In fact, I feel the reverse. I feel like connection is really more intimate. Technology facilitates it. It doesn't really interfere with treatment, and none of my patients so far have complained either. So I feel like with telemedicine, care has spread all over the United States. I see patients in Illinois, I see patients in Texas, I see patients in New York. So I feel areas where normally I would never be able to travel to and I would never be able to treat patients, and now I am able to do that. I've noticed that my patients don't skip, sessions because, they don't have, the burden of traveling, and coming to my office is also reduced. So that has improved compliance.
Wow, so telehealth has actually been helpful to your practice.
I have, I do, I feel so, yes.
Hmm. Great. Okay, and if patients want to contact you, how can they reach you?
Sure. So my website is basupsychiatry.com. I'm also on Psychology Today. I have a profile there. The website has a contact me page, there's a phone number. My office manager is, we take pride that you don't have to wait for appointments. We are very quick to respond to your calls. There are no wait times. Nobody waits for medication refills. I'm very respectful of your time, very respectful of my time and my commitment as well.
Okay, sounds great. Okay, thanks for your time.
Thank you.